Thank you for joining us for Helping Seniors Radio. Join us live every Wednesday at 12 noon on the Space Coast's 90.3 FM, WEJF Radio, and or online at wejf.net. Now let's join this week's Helping Seniors Radio program, already in progress.
In vaccinations for our people 65 and plus. Orlando Health just started operating 6 sites throughout Central Florida. Jackson is operating 3 sites with more to come, and we're working with them to support them on doing some drive-through testing sites. And between both systems, they think each system will be able to do a minimum of 10,000 doses a week for people 65 and up. And I think you're seeing other hospitals throughout the state of Florida also step up. We're now in the new year. I think people are getting into the groove, and I think we're going to make this available. So we're really happy that the hospitals have stepped up, stepping up for our seniors, and we want to continue to do that. At the end of the day, when we have the feds tell us a few days before the next shipment of vaccine comes in, they say, where do you want it sent? And what we're going to be doing is we're going to be sending it and prioritizing, whether it's a hospital, whether it's Publix, whether it's whoever. We're going to prioritize it to those areas that are the most effective at getting vaccines to our senior citizens. And so as Orlando Health and Jackson may need more because they're doing it, we'll give them more. If there's other hospitals or other entities that aren't using the allotments that they were given, then we'll dial that back. We want to be able to get the shots in arms, and that's what we're going to be able to do over these next many weeks, which should be really exciting to see a lot of this stuff happening. We also were able to announce 4 new initiatives yesterday. We have announced that we are going to take some of our major drive-through diagnostic testing sites and convert them into drive-in vaccine sites. And so we're looking at some places now. We're going to have an announcement tomorrow. So I think in key parts of the state, you're going to be able to see that. We hope that that will be able to deliver, a relatively large amount of vaccine on a daily basis in a way that's convenient. I think the testing has been very successful. I mean, we put through thousands of people at these test sites on a daily basis. Why can't we then use that same structure to help with the vaccinations? And so we're going to be able to do that. We also announced that we're going to continue expanding our mission to bring vaccines to places of worship, particularly in underserved communities. And so on Sunday, we were able to partner with folks in Escambia County at one of the churches there, and we vaccinated 500 seniors. They're also scheduled to come in for their booster shot. But as more supply becomes available to us, we want to look at innovative ways to be able to get it to places like that. So we're going to be at places of worship. We're going to be at supermarkets. We're going to be getting it to where the people are so that they have easy access to this. And as our supplies increase, as we continue to get more vaccine in the state of Florida, all these initiatives are going to increase accordingly.
And Kerry, as you just heard, as Governor Ron DeSantis was saying, a lot of activity, a lot of positive movement, trying to get the shots administered as quickly as possible at many different locations. Churches now will, in the very near future, be one of the areas where you can get a vaccination. And as folks just heard in that piece from the governor, public supermarkets throughout the state will be gearing up. A couple of counties are already offering those services as of Thursday of this week, but it looks like the entire 750 Publix pharmacies throughout the state at some point in time in the very near future will be offering the vaccination. So there's good news on the horizon here.
Yeah, I was gonna echo that, John Harper, and say that I really think, as we were talking about even last week, we all did a really good job of staying safe and trying to follow all of the CDC guidelines throughout 2020. And while most of us would agree it wasn't the most fun in the world, we did it. And we're this close, and let's make sure that we keep all these precautions going, that we stay safe, and that we just kind of ride out. The wave is coming in on these vaccines, and it won't be long before everyone has an opportunity to be vaccinated, and it really does seem like a positive thing So let's just stay the course and stay safe with all of that.
Absolutely.
So with that sort of as an update in mind, let's turn back to Bill Johnson and start talking a little bit about. I know you guys from a lawyer's office perspective, you really went into kind of a whole different mode last year when COVID first hit. You were deemed an essential service, and of course, the business of, we talked about this before, the business of life goes on. So all these things that your office normally is helping people with just continued through all of this.
It did. We help seniors find affordable long-term health care. We also help them do their estate planning and also their advanced directives and powers of attorney, which are very important in a time like this. If you get sick and end up on a ventilator, it's a little too late to execute all those documents.
Yeah, that was a thing that I was thinking about. We had a report, my daughter's coworker's father passed away with COVID, even just here this past weekend. And apparently it was one of those cases where he had fallen ill, but apparently it goes from bad to really severe real quick. And I would imagine people who want to be sure that they do the right thing, this is kind of like a wake-up call and says, hey, we got to get this paperwork straightened out, because if you get real sick like that real quick, you're not in a position to be doing much of anything except trying to survive.
Correct. And as you pointed out in the intro to today's show, over the holidays, a lot of families are discovering that it may be too late for their parents.
Wow.
They go visit them on Thanksgiving or Christmas and stay with them for some length of time, or even through a Zoom call, they may be interacting with them. And all of a sudden they realize things aren't necessarily right. Mm-hmm. And that can be in the form of breaking routines, or some sort of medication issue, or they just don't sound right, or they're acting weird, and all of a sudden you realize that somebody's got dementia and they're fairly far along the process. And at that point, typically it becomes too late to get these documents executed.
Yeah, and so one of the things that occurs, it occurs to me as I'm thinking about this, is that I've often said, and I've heard Joe repeat many times, about the importance of getting an aging plan together, which is sort of a document that helps you decide what you do when you hit certain contingencies or possibilities that you might encounter as we grow older. And I've always used the term that I think aging is on-the-job training, because a lot of times, especially as the adult child of an aging parent, the first time we run into it, it's almost like an oh my goodness moment, and then you're overwhelmed and you're not sure what to do next. And I know that must come into a lot of the calls you get about Medicaid planning, for example. It must be like all of a sudden, oh, we got to do something now. What do we do?
Yeah, and I would emphasize, this is not a subject area that people delve into until there's a crisis.
Yeah.
And, one of the first things is educating yourself, and that's what we do on this show and
right.
and try to do in a variety of different publications and putting the word out there so people know what to do. But, Money Magazine did a story about retirees some years ago, and what were the, top 20 concerns. And everybody, when they retire, focuses on living the, lifestyle that you're accustomed to, mm-hmm. Worrying about outliving your money. And way down, 8 or 9 is, it's some sort of long-term illness. And that's not, in people's headlights.
Yeah, and it's probably the reverse, right? Because what probably comes up is when that comes up, it comes up quick and it comes up serious.
Correct. And that can affect the first two very much.
Yeah.
Which all of a sudden you're not living your lifestyle and you may not have the money you thought you had. One of the things, as you mentioned, that families become educated in very quick is how much long-term care costs.
Yeah.
Most people have no idea, and it's not covered by Medicare. A lot of people think it is, and it is not. And you can see home health care bills, around $10,000 a month. Assisted living start about $3,500 and go all the way up to $6,500 a month.
Wow.
Nursing homes here in Brevard County are like $10,000 to $11,000 a month. Not many people can afford that level of spending for any length of time.
Yeah, and that, I guess, really maybe the place to back up and begin from is, most of us have just assumed that mom or dad probably has something that would help if it ever came to that. And first of all, that's probably a bad assumption. We know what the word assume means.
Right. The actual percentage of Americans who have long-term care insurance is around 4 or 5%. So the assumption should be the other way, is they don't have anything.
Yeah, and I've heard Joe talk about this many times on radio and TV programs that he's done with you about the fact that the fact that for most people, it would bankrupt them in a mere matter of months if they don't have some way to do it, and that's maybe where this whole concept of the planning comes in. But maybe the place to begin on this is what is Medicaid planning, and what does that actually mean as a concept?
Well, let's start back at incapacity planning.
Okay.
You should really have a durable power of attorney, giving somebody the authority to manage your finances and all your finances. You should also have a designation of healthcare surrogate, naming somebody to make your healthcare decisions if you're unable to. And then you should have a living will, which is your end-of-life decisions, whether or not you want to be kept alive if you're incapacitated and in a terminal condition, end-stage condition, or a persistent vegetative state, and then whether or not you want a feeding tube if it's just going to prolong the dying process. That at a minimum is what you should have in place. Like I said, most Americans don't have long-term care insurance, so paying the bill is another problem. Mm-hmm. How are we going to afford these costs? And typically, somebody's kids are working. They have their own families. They have their own bills. And they're not in a position to be, there 100% of the time, whether emotionally or medically or financially. Mm-hmm. And so you run into a lot of problems very quickly on how you're going to address the situation. Basically, for long-term care, you're looking at maybe 4 different ways of paying for it. One is you pay out of your pocket. And I told you what the costs are. Not many people can afford to do that. Mm-hmm. The second way is you would have long-term care insurance, mm-hmm. which would pay the bill. The third way is if you're a veteran, there may be some benefits under a program called VA Aid and Attendance, but that is a means-tested program. You have to qualify based on your income and assets, not just that you have a medical need for assistance. And then the last way is Medicaid. And again, Medicaid is a means-tested program as well. And so you have to qualify for that. So there can be an extreme amount of money that gets paid out very quickly. Now, if you haven't done your incapacity documents, your power of attorney, healthcare surrogate, or living will, we may end up in a guardianship situation where your kids may have to go to court to get that authority to make your medical and financial decisions. And you may actually have to be legally declared incapacitated and have your rights stripped away. So it's much easier to have these documents in place. I can tell you a lot of people do. There is a good percentage of people who don't, and kind of go around life with their head in the sand and hope for the best. But it's much better to have these documents in place than to end up in a guardianship situation.
Yeah, and we're going to dig really deep into all of this as we come back to the second part of the show. Real quick, before we go to the mid-show break, let's go ahead and give the number in case you want to reach Bill Johnson's office and maybe ask a question or even ask for that great booklet that you put together, the senior, I'm trying to remember the exact title of it, but it's a great primer on things you need to know as a senior. But how do we get in touch with your office?
You can reach us at 321-253-1667.
All right, and we'll be back with more Helping Seniors next.
And here on 90.3 FM, you're listening to Helping Seniors of Brevard, heard every Wednesday afternoon, 12 noon to 1 o'clock, right here on 90.3 FM. John Harper with you, Kerry Fink, Bill Johnson, and right now, Kerry and Bill, we have the founder of Helping Seniors of Brevard, the president of the organization, and Kerry, we've got none other than Joe Steckler.
Oh, that's wonderful. Hello, Joe. How are you today?
Hi, Kerry. Hi, Bill. I was listening to the show, and I'd like to back up to what y'all were talking about in this COVID shot.
Yes.
I took the shot on I'm in the Melbourne Terrace Rehabilitation Program as a result of all the problems I've had, but I'm coming out of it, and I think I'll be back before long.
Yes.
But I had the COVID shot over here, and frankly, in all my life, my 87 years of taking shots, it is the best shot I ever had.
Wow.
I never felt the shot, and I had absolutely no ill effects, no sickness, no redness. My arm didn't hurt or anything, and I'm looking forward to getting the second shot next week.
Oh, that's terrific.
I've talked to people over here that are reluctant to take the shot because they think there's problems with it. And there are the percentages that they've run on this thing that it's so minuscule, the number of people who have had ill effects. I just can't emphasize enough for people to take the shot. And even if you're young and you are a healthcare worker or anything, certainly you should take the shot, because if you get exposed to it, you can catch the darn stuff too. I've had members of my family contract the coronavirus. They were lucky. They got sick, but one of the ones was a nurse, and they had a good doctor, and they had no ill effects from it. And the person was my son, and I don't. He's no young chicken anymore either. He's still young, but he's at an age where he needed to take the shot, but they haven't been able to get those shots yet.
Mm-hmm.
So you don't know when you're going to contract this stuff. The second point I would like to make is, if you think wearing a mask is foolish, you're out of your mind. Wear the mask, wear it properly, and stay away from people a good, proper distance. They do a good job of doing that here in the rehabilitation center. But, we can talk about it and talk about it and talk about it, but you've got to stay and observe the safety precautions, Kerry and Bill. And have you got anything that comment on that, Bill?
Well, I would just say, I don't know if anybody's seen the photos of us here at the studio, but we're all masked up and lather up with hand sanitizer, and even on the radio here, me and Kerry are both wearing masks. So, I mean, we exercise the precautions here. I certainly do at my office. We even go so far as to take temperatures and have basically a sneeze guard on our conference table. But I think that's a very good point, Joe, especially given your other point, which is that we played a clip from the governor, and they're making public access to the shots available, but it's 73 and older at Publix, and I think if you go through the county system, you could get it at 65 and older. But for the rest of us, we still all, we all need to be cautious. Right. It's still out there. It's still taking lives. And for the most part, we can't let our guard down.
Yeah, well, I agree. And Kerry, I listened to one of the callers into several of the callers into our office to Helping Seniors. And one gentleman said he was frustrated because he had called that number to get on a shot list. He had called them 50 times and he couldn't get through. Well, until this thing gets all sorted out, you can't vaccinate 330 million people in a week.
No.
It takes time. I don't care who the president is, and I don't care what they say. It takes time. And even if you had every hospital in the United States and every public store doing it, it still would take time. And I don't even know where they stand on the production of the vaccine. But what's important is keep trying to get the shot. And, you don't get anything unless you pursue it. And you got to make up your mind. I'm going to be patient, and I'm going to do this. And in the meantime, until I can get the shot, I'm going to do my very best to observe every safety precaution there is. And I don't know of any better advice than that, Bill and Kerry. Can you think of any?
Well, I would point out, too, it's not just one shot, it's 2 shots. And you actually have to get them anywhere from 21 to 28 days apart. So it will require a return visit. And even if you get the first shot, supposedly that doesn't give you the immunity that you need. You require both of them.
Yeah, you really do have to follow through. And I think, like we were talking to, Joe, at the start of the show, the thing that we've learned from talking to all the assisted livings that Helping Seniors is connected with and have supported the work of Helping Seniors, and all of the home health agencies, they're all telling us the same thing, is that you can stay safe when you follow the precautions. You wear the mask, you wash the hands, you do the social distancing, and all of that works. And like we were saying at the start of the show, Joe, we made it this far. Let's not blow it in the home stretch when the vaccine is literally on its way day by day.
Well, we also need to be aware of the fact that hospitals have been authorized to give out vaccinations as well. You need to check with the local hospitals within the sound of our voices to ensure that they are ready and prepared to give out those vaccinations, but you don't have to just wait for the county to do that. Also, if you are a veteran, the Veterans Administration, the VA clinic at Viera, and also the VA hospital in Lake Nona are getting set up to give out vaccinations as well. And from what I've been told, they will be contacting the vets to make vets aware of when the vaccinations will be available. And it's advisable that you contact your primary care physician at the VA and let them know that you do want a shot so that you're on the list and you don't get overlooked, which could be easily done. So contact the Veterans Administration, whether you go to the Viera Clinic or at the VA hospital in Lake Nona in Orlando, and let them know, your primary care physician, that you want that shot as well.
John, do you know if there's any age limit on that?
Currently, the VA is trying to go by the Center for Disease Control guidelines. And as a result of that, there are age limitations, but the VA is indicating once they are set up and prepared to give out the vaccinations, they're going to move through them pretty quickly and make sure you're on the list.
Really makes good sense. Well, so this is so important that what we're talking about, staying safe through COVID times, and I guess that was the kind of what led us into the topic today, Bill, that we were talking about before the break, which is people doing the right paperwork, because, like I said, if you run into this COVID thing, it sure hits real quick and real hard and real unpredictably.
I think a couple of weeks ago, or maybe a couple of months, it must have been a couple of months ago, we were talking, and I said, I've run an ad now that basically says, if you've waited, if you're waiting to get your documents done till the big one hits, the big one's hit.
Wow.
It's already here. and you really need to have everything prepared.
Yeah.
And especially when this thing was in its early stages, because people were sick, they were ending up in ventilators, isolated in assisted living facilities, nursing homes. We couldn't do any documents for those folks. And, subsequently their bills didn't get paid. They didn't have people making the healthcare decisions they needed. Nobody knew about what their end of life wishes were. And we couldn't even get access, even if somebody had capacity, to do those documents because they weren't letting anybody into those facilities. So when the crisis hits, is not the time to say, oh, we need a power of attorney or a healthcare surrogate. Those should be done well in advance of the crisis.
Yeah, and everything that I've heard you and Joe talk about on the dozens of TV and radio shows and things that we've done over the years, it always makes the sense. It's like a penny wise and pound foolish, because the time and the energy and the finances that it takes to get this set up is minuscule compared to what it might cost you if you run into that situation and you're not prepared.
Correct. You're looking anywhere from, $100 to $250 or so to get a durable power of attorney. If you have to do a guardianship, you're looking $7,500 or more.
As you indicated, Bill Johnson, the big one is here. I like that. And there's no sense in waiting any longer, because now is the time to act and make sure you are able to get all of that paperwork accomplished, preferably through your office, Bill Johnson. But we also have an additional update from Governor Ron DeSantis talking about getting the various locations at Publix ready to start giving out the vaccinations, along with the hospitals and counties. So let's give a listen to that real quick.
7 days a week. We don't have time right now to be taking the weekends off. I think we need to have all this stuff running. Our test sites have run on the weekends for months and months, so we need the vaccine sites to do that as well. I've also challenged the hospitals, your efforts, make sure that's accessible to our seniors 7 days a week. And you know what? Many of them are stepping up, and they're going to do that. So when we commit to opening up a site, we want to keep it open. We want people to have access to it.
And so that's the governor talking about having access to the vaccinations 7 days a week, not just Monday through Friday, which is good as well.
Yeah. As I keep...
John,
Sorry,
I
Joe.
one more point I want to make, John.
Yeah, go ahead, Joe.
Yeah. I go back to what Bill was talking about on Medicaid planning and estate planning and the importance of doing this early on. And I can give you a couple of examples that I've observed myself in the last 9 or 10 weeks since I've been in this rehabilitation. I've watched people with strokes get 2 weeks of therapy and then sent home. And they're sent home because they don't have a good insurance plan. They can't afford what Bill was talking about, and he's making some extremely good points for people to pay attention to. There are ways to, for lack of a better word, I'll say game the system. And if you start your planning early on, you can see how you need to place your assets and how you can do things to stretch your money and make yourself available to, or available of Medicaid help. There are ways to do it. And the sad part about it is that people don't know this because they don't go to the seminars like Bill conducts over at one senior place, and he's done on the air. It's extremely important that more American people right here in Brevard County start paying attention to ways they can help themselves, and the early planning will many times prevent some of these things later in life. The gentleman I've been thinking about, once they sent him home, he fell 22 times in one day, and there was no help for him. Luckily, he did not hurt himself. But what happened to him after he found out he had no more insurance money, had nothing else to handle it, had no assets himself to pay for it, he went into a state of depression. I kept trying to contact the man. I knew this was going to happen. He was my roommate in the facility. And luckily, he's pulling himself out of this. But he's only 55 years old.
Wow.
And he's got the strength with support to make some good things happen. But, Bill, there's just no substitute, as I'm finding out, for early planning, even if you're in 20s and 30s.
I agree. I totally agree.
And the thing that occurs to me, Joe and Bill, is when I've watched you guys talk about this on TV shows and radio shows, is that this is one of those areas where particularly not taking an action becomes extremely dangerous because, or sometimes we might take an incorrect action thinking we're doing the right thing and then actually making our situation worse. And in particular, I'm referring to, I guess, the thing that I've heard you guys discuss before about these look back periods where all of a sudden you find yourself in need of some kind of help from Medicaid or the Veterans Office, but maybe you deeded something over to a child or you gave them a big gift or something like that. Now you've caused a real problem because you just didn't ask Bill the right question ahead of time.
Right.
Yep.
I agree.
Planning is the key word, and I've heard you say it so many times, Bill. Planning, planning, planning. And don't think that because of your age, you're immune to things like strokes and other things happening to you, because you're not. It can happen to anybody. So the best thing to do is put everything in place that you can do the very best you can to take care of yourself if something does happen. And that's my thought. And I'll just thank you guys for what you're doing today, and I'll be back.
Yeah, thank you, Joe. Yeah, and I was we were talking about this actually before the show was on the air. Joe has been quite busy working on getting set up. We announced last week, actually, for the very first time, that we have a date for the 2021 Helping Seniors car raffle. That in a minute I'll give you that date. So grab a pencil and a paper, because we're also going to make sure you have Bill Johnson's office number as well. Hopefully the discussion that Joe and Bill and John and we've all been having here will encourage you to start off the new year on a good foot and get this paperwork done once and for all. Well, I wouldn't say once and for all, but at least you'll have it in place and you're prepared for the things that you might meet on the road ahead. So the date for the Helping Seniors car raffle is going to be October 9th, 2021. So it's literally almost a year to the day that we gave away that beautiful 2020 Chevrolet Camaro that our friend is just zipping up and down the highways. I'm sure enjoying that. He ended up choosing to upgrade, if you remember, John Harper, into the Chevrolet convertible. And looked really sharp in that.
Yeah, that was a nice one. That was in the showroom, and we were leaning up against that.
Yeah, it was a great car. And so this year, the car raffle returns. Joe has worked everything out with AJ Hires at Boniface Hires Dealerships and with Mark Pilot, the very generous owner of the American Muscle Car Museum. And we're excited that we're going to be back for this on October 9th, 2021. So you're going to be hearing a lot more of that real quickly. But go ahead and get that date on your calendar. October 9th, Saturday, October 9th. I am sure we'll all be vaccinated. We will be ready to go and have a grand time at the American Muscle Car Museum that day.
And Kerry, speaking of the vaccinations, we have one final update from the governor from that press conference in which he was talking about other ways and means in which we can be looking for vaccinations in our area. So let's go ahead and listen.
Vaccines to EMTs and to paramedics. And we were the first state in the nation to mobilize county health departments and community emergency managers, county emergency managers, to begin active vaccination of seniors in the general population. And if you remember, I was the first state to announce, okay, we're going to do nursing homes, we're going to do health nurses and doctors, but then we're going for seniors. We're going to put seniors first when it comes to the general population. We've had some other states follow. Most states in this country right now are not actively seeking to vaccinate people who are seniors, particularly those who are in their early 70s. We believe that we need to put seniors first, and so that's what we're doing. We also were able to recognize gaps, as I mentioned, when there was a gap in long-term care coverage in the first week. We sprung into action and were able to knock out over 100 facilities in 6 days. And now that we're seeing a little slower pace than we wanted to, we're now stepping up again to complete that mission. Just before Christmas, it's important to point out, 95% of hospitals did not get any vaccine until right before Christmas. We had 5 major hospitals. They were working on vaccinating their staffs. We were doing the long-term care mission. CVS and Walgreens was also doing that mission. They got it right before Christmas. They've been working to vaccinate their nurses and doctors. But now that we have the priorities for seniors, they're all working to get into the communities. And I was just in Tampa General talking with those folks. They have big coverage throughout Central Florida, West Central Florida. They're going to be doing a lot over these next couple days, have some exciting announcements. And as I mentioned, Miami, Orlando, a lot of people are really working hard, and we really thank them for making seniors a top priority. And then just right around the new year, all 67 county health departments were finally given a vaccine, as well as over 200 hospitals. And so what you're seeing, every county is different. The way the health department interacts with the hospitals, and so it's not going to be a one-size-fits-all approach, but what we're trying to do is utilize those county health departments, partnering with the state, partnering with local providers to be able to get into senior communities. And so right before New Year's, we were down in Delray Beach at Kings Point in partnership with Palm Beach County Health Department. This is a 65 and older community. It's not a nursing home or anything like that, but we showed up. We were able to knock out several hundred vaccines and then obviously schedule them for their booster shots. So we're looking to be able to continue doing that as we move forward, and that's going to be in conjunction with these counties.
So the governor is moving forward, the state is moving forward to making sure that all of the counties are prepared, Kerry, to give out the inoculations.
Yeah, no, it sounds good, John, and I guess the watchword was the same one that we were talking about last week when you were talking about your own experience about getting your vaccination schedule, which is you just have to be patient, tenacious, and then I guess as we keep learning, just very careful. Just don't let up your guard with all the safety precautions. And so, Bill, as we're kind of circling back, I wanted to make sure we also got the information out so that people know. Like I said, if they have heard what you and Joe have been talking about, you know, this ounce of prevention being worth a pound of cure. And you will sit down at least for the first conversation and kind of help somebody track what they need to do next, right?
Correct. We do free consultations so they can come in and talk to us about what the issue is or what the plan is, and then we can help them come up with a plan, whether it be an estate plan, an incapacity plan, or a long-term care plan.
I really can't imagine why somebody wouldn't do that unless it was that they didn't have your phone number. So let's make sure they have your phone number.
Okay, our phone number is 321-253-1667, and we also have a website, www.floridaelderlaw.net.
Yeah, and if you want to get somewhat pre-acquainted, make sure you check out helpingseniors@brevard.org and check out the great TV shows that Bill and Joe have done together with lots of good information about things that you need to be aware of. All these topics that we've been just lightly brushing over, which is all the time we have during today's radio show for it anyway. But you can find all those TV shows. They're all there available for you at helpingseniors.brevard.org. So I'm thinking that's about all the time we have for today, and want to thank you for joining us for Helping Seniors Radio. We'll be back next Wednesday right here on 90.3 FM WEJF.